Hello everyone, and thank you for joining us for Enloe Medical Center's Healthier You Facebook Live series, where today we are going to be caring for our moms. About 10% of pregnant women and 13% of women who have just given birth experience mental disorders, particularly depression, according to the World Health Organization. But luckily, maternal health disorders are very treatable and women are not alone. Hello everyone, I'm Susie Lowry Hall and I'm Enloe's Community Outreach Coordinator, and I am here with my special guests. I have Heidi Cantrell right here, who is the Nurse Manager of Enloe's Mother, Baby, and Education Center. I also have here Beth Miller, and she is our Postpartum Support International Resource Coordinator. Over here I also have Stevie Shanoff. She is a Enloe Lactation Specialist, and then we're also joined by Megan Mitchell, who's a Health Education Specialist with the WIC Program. So thanks everyone for joining us. We are all here today to talk to you in honor of World Breastfeeding Week, which is celebrated August 1st through the 7th every year. But before we dive into our discussion, please remember that the information we're about to share is not intended to be medical advice. If you have specific questions about your physical or mental well-being for yourself or a loved one, please talk to your provider. And as always, feel free to post comments in the comment section and we'll answer them as best we can during the broadcast. And with that, we'll go ahead and get started. I'm going to go ahead and start over here with Heidi. Thank you again for being here. But let's start by talking about who is at risk of developing a mental disorder during pregnancy or after giving birth. And then are there certain women who are more prone to this?
That's a good question. Actually, perinatal mood and anxiety disorders that we'll call PMAD is the most common complication during pregnancy. And it can happen to anybody during pregnancy as well as the first year after delivery, including dads as well.
Okay.
But there is a slightly higher risk for those moms and dads who have a history of depression or anxiety or compulsive disorders, as well as family history or personally and of themselves. And sometimes there comes like shame or guilt in not getting the resources that they need.
Mm-hmm.
So the earlier that it's assessed and treated is very, very important.
Good. Okay. So how can these disorders affect moms and their babies? How can they affect the rest of the family?
Right. Well, it's been found that when you feel guilty or shameful, you can feel lost and alone.
Mm-hmm.
And as a result of that, it may be a situation where moms or dads have a hard time caring for themselves or their baby. And so therefore, not just caring for their own or baby's needs, but also those emotional needs. There's a lot going on in those first 3 years of life, a lot of brain development, attachment, and what we call that dance of attunement, where it's all about human relationship-based experiences. And when a baby is trying so hard to be able to receive the love, the connection, and communicate their needs, but yet they're getting a flat affect and not an appropriate response, can actually affect them for a lifetime. So,
Okay. So I'm going to switch over here to Beth. Hi, Beth. So do these disorders resolve on their own, or do moms need to seek help? And then how would a mom or a loved one know if a mom needs to seek help?
So these disorders are real medical conditions. They typically won't resolve on their own, and that's why early screening is very important to identify and treat the symptoms. And we're really fortunate that all of our providers at Enloe that have privileges are screening prenatally and after delivery with the Edinburgh Depression Scale, the screening test.
Mm-hmm.
So that helps with that to get them into early treatment and assess that throughout as they go throughout the pregnancy and delivery, which is important, and even into the first year of life for babies. And it's common for a new mom to have baby blues, which maybe last for the first 2 weeks, mood changes, things like that.
Mm-hmm.
But if they're struggling for a long time, it's really important for them to seek that help, and that's why we're here. And Enloe does provide information for mothers prenatally, after delivery, everything, so they know what signs to look for and the treatment options that we have available for them.
That's great. Thank you. So what are some of the services we do offer here at Enloe? You mentioned a few, but that helps mom who are experiencing mental health issues. And are there other services in our area that they can access? And would you tell us more about all that?
Absolutely. So Enloe Medical Center offers the opportunity for medication and individualized group therapy. And the services are offered at all of our women's services clinics, as well as Enloe Behavioral Health, the Mother and Baby Care Center, and our Mother and Baby Outpatient Education Center. The community resources include the County Crisis Line for anyone who feels like they're in a crisis situation, counselors who have attended the Postpartum Support International certification training, which gives them a little bit more education in regards to the PMAD.
Okay.
And our Northern Valley Indian Health Center also is a resource. Some online resources we have available are the Butte 1211,
Yes.
healthcentral.org, great, lots of resources there. And the Postpartum Support International has a really good website with lots of options. And the contact information for all of these resources are included in the Going Home booklet that's given to every mom who delivers, and also on our Mother and Baby Care Center webpage.
That's awesome. That's a lot. That's very nice. So is there anything moms can do on their own to help them feel better?
Yes, and so we're super excited. That's why we're going to have our Mother Stroll event in August. We're going to encourage moms to take time to care. So the CARE are things that we're representing to kind of help them through that. So the C is create time. We want moms to rest and have good nutrition because it's essential for all new moms. And make time to eat healthy foods, drink plenty of healthy fluids. And the A is for ask.
Okay.
Because it's important to take care of yourself as a new mom so you can enjoy your baby and your new family. And if you're struggling with mood changes that are interfering with that ability, I want you to ask for help. So talk with your OB provider, attend a support group, ask friends and family for help, talk with a therapist. Ask the faith community for support, resources. Don't ever feel like they have to be alone in that. And the R would represent recreation because having fun is super important.
I like that. Okay, good.
Take short walks outside every day when weather permits. Sing and dance and play with your family. Join a support group, meet with other moms and babies, and schedule regular play dates.
Okay.
And then the E is for education. So, because that gives you confidence and kind of reminds you that you're not alone. So reach out to the resources that we have in our community. Enloe's Mother Baby Education Center, WIC, Butte County Public Health, Northern Valley Indian Health. And many of these educational resources are going to be at our Mother's Stroll event on August 3rd, and we would love to see you all there.
So exactly. That's really cool. That's amazing. So I'm actually going to switch on over here to our other guests. So Stevie, thanks again for being here. So one of the challenges some women face after giving birth is breastfeeding. So since it is World Breastfeeding Week, can you tell us why breastfeeding is so important and what are some of the benefits moms will experience from that?
Yeah, there's so many wonderful breastfeeding benefits for mom and baby, but just to list a few because I could go on for a long time, but just a few is for baby is that it decreases the risk of SIDS, it decreases the risk of childhood obesity and childhood diabetes. A really important one is childhood cancers such as leukemias and lymphomas.
Wow.
So that's a really big one. Breastfed children as well score higher on IQ cognitive tests. So I thought that was really
interesting.
It's interesting. And have less cavities, which we know as parents, that's a big one. And braces, it's less likely to have braces. So those are some for the baby.
Okay.
Some really important ones, for moms, they were talking about the postpartum depression. The longer you breastfeed, and it also helps decrease that risk of having that postpartum depression. So I feel like that's a really big one. But along with decreasing the risk of osteoporosis and ovarian and breast cancer, the longer you breastfeed, the lower the risk. So those are some big ones, as well as postpartum bleeding, and some other great ones would be that it helps you go back to your pre-pregnancy weight, which us moms really like that.
That's true. Nice. Thank you. Okay, so what services are available to help mom in the area of if they're having trouble breastfeeding?
Here in Chico, we're really we have some really great resources. We have our Enloe Mother Baby Education Center off of Cohasset, where we have outpatient lactation consultations as well as pump rentals and pump parts, and we have a wide variety of classes that we offer from infant CPR to parenting classes. So that's a great resource. We have Northern Valley Indian Health, they have breastfeeding support and a lactation consultant there. We have our WIC offices through the communities that help with breastfeeding support, nutrition, and pumps. We also have lactation consultants in some of our pediatricians' offices here, which is so great that we have that with our community. So those are some great resources.
That's awesome. Thank you so much. So Megan, we're here to you. We're so glad. So thank you again for being here. So we have Mother Stroll happening this Saturday, which is another great resource for our parents and in general, not just our moms, correct?
Yes.
Okay, good. Can you tell us more about the event and what people can expect to see there?
Yeah, so like you just said, it's not just an event for moms, it's an event for all the family members, but especially the family members who are moms like close support systems. So those people that are going to be there with her to help with baby and things like that. You know, it's really great to have them come to this event too. So it is a Mother Stroll event, so naturally we're going to do a stroll. So the families are welcome to bring their strollers, sunscreen, hats, you know, everything to keep that sun off those precious babies. But we're going to take a walk around the park together. And that's going to be a really good time for moms to kind of maybe meet and just kind of feel empowered as like a group together, you know, coming together as a community. And then we're going to have a DJ there. We're going to do face painting. We're going to have snacks. And there's also going to be a drawing, so anyone who attends is able to possibly win a prize from the vendors that are donating them.
Nice.
So that's really exciting. And then organizations like Enloe and WIC and Northern Valley Indian Health, you know, we're all going to be coming together to help answer on-the-spot questions that moms may have or the family members may have. You know, we're going to be right there to offer that support. And so hopefully everyone will be able to walk away feeling really empowered and really together as a community.
I love that. Yeah, everyone will be able to learn to take care of themselves.
Yeah,
I like
exactly.
that. Yeah. So this has all been really great insight. Thank you, everyone. And thank you for being here. But before we wrap up, are there any words of wisdom that you would like to share with our viewers today?
I would just like to say that if there are any moms or family members out there who may be struggling with feelings of depression or anxiety, or maybe if they're just having a trouble, you know, breastfeeding, or maybe it's a combination of everything, we as community resources are here for you. We want to help you. You know, that is one of the reasons why I feel like so many of us are a part of this, is because we have such a heart for helping people, and nobody should ever have to feel like they are doing something wrong as a mom or as a dad or anything like that. And if you are feeling that way, although it may be common, you know, 1 in 7 women may experience those feelings, it's not normal. And it's, like Beth said, it's not something that can kind of resolve itself. You need to reach out to us, to, you know, everyone in the community that can help you, and we're here for that. And we'd be more than happy to meet you at the Mother Stroll event. Please come and say hi to us. We're all going to be there. And say, I saw you on the Facebook Live.
And maybe you'll get something extra special.
Maybe like maybe get a picture with us, something like that, you know. So we're just really excited to be able to support our community in this way.
I love it. Thank you. Anyone else?
Okay. Just to kind of bridge off what you had said, Megan, is that in order to care for others, it's so important to care for yourself and allow others to care for you. I think sometimes as women we try to do it all, and we're afraid to reach out and allow other people to make meals or to care for us and to love us and give us breaks. But it is very important to have that balance. And sometimes it's really hard for a mom to be able to express those emotions of feelings of guilt or shame. And that's where you dads or friends or family members can do it for her, to be able to utilize those resources, come to the Mother Stroll event to learn how you can help her help herself for the family strengthening. So we're excited to have you join us and use our services, because we really want to help you become a strong, healthy family.
That's great. Thank you. So thank you, everyone. Thank you, Beth. and Heidi and Megan and Stevie so much for being here. And thank you all for joining us. Please join us next month for our next discussion on Facebook Live. But until then, maybe we'll see you Saturday for the Mother Stroll event happening at DeGarmo Park in Chico from 10 to 11:30. And we hope to see you then. Take care.